First comprehensive scan of school nurses took place this month, finding about half of the state's school districts operate without a healthcare professional on staff. KIMT News 3's Sananda McCall is joining us in studio with how the shortage impacts our students' overall experience. Sananda.
Well, I spoke with the health services coordinator with Rochester Public Schools, and she tells me school nurses do a lot more than the public actually realizes, which is why she says the stats are alarming. She quoted a former U.S. Surgeon General in part saying, quote, "There has to be a marriage between health and education."
I think nurses in every school should be a mandate. School nurses can help identify chronic diseases early on. They do vision and hearing checks for children.
But across the state of Minnesota, only 49% of school districts have a licensed nurse on staff. Of that number, only 34% of districts are required to have a licensed nurse due to its enrollment of more than 1,000 students. And when it comes to schools with lower income,
school nursing is very dependent upon money that they get from the state and the property tax money that they get. They're not getting the tax revenue from property taxes, or they're getting just a small amount because the houses just are not as expensive. So
Chris Bierke is the health services coordinator at Rochester Public Schools. She says this isn't the only issue playing a part in the shortage.
Nurses have to make a livable income. So unfortunately, they can go to a hospital and they can make a much better salary than they can if they come to the school.
But that doesn't change the need.
One thing that we do is we educate students on being independent. So students with chronic disease conditions like diabetes, they may come in and in kindergarten, first grade, need help with everything.
Then there's the added support system.
Also, children just may be having a bad day. It's a respite for them to come down to the nurse's office.
Now, I'm told RPS is short 4 licensed nurses and is in the need of 2 health office nurses. The district's nurse-to-student ratio is about 450 students to 1 nurse. Jess?
Thank you, Sananda, for that report. According to the CDC, having a licensed nurse on staff is also cost-effective. For every dollar spent providing a nurse at school, families save $2.20. It comes from preventing costly emergency room visits and parents missing time at work.